Wonderful. Thank you so much again, everyone. We are so pleased to have our speakers here to provide you with content on the Community Engaged 101, Community Engaged Research 101, my apologies. So we have Dr. Wei-ting Chen, who is the Executive Director of Office of Community Engagement at Stanford Medicine and Food for Health Equity Lab. She has over 10 years of experience in developing academic community partnership for research and service learning projects with a specific emphasis on building health equity. She joined Stanford Medicine in 2019 and previously worked at the University of California Cooperative Extension System as a county-based faculty. She has received her PhD in sociology from Johns Hopkins University. Thank you so much, Dr. Chen, for being here. Now, and then we have Dongmei Tan, Community Engaged Research Manager, and also Maternal and Child Health Research at Maternal and Child Health Research Institute at Stanford School of Medicine. She's also under the Office of Community Engaged Research. Dongmei leads the efforts of mapping community community engaged research resources across campus, building partnership with the offices and community partners, providing technical assistance to researchers and partners, and developing community engaged research related trainings and toolkits. She joined Stanford in May 2022 and from San Francisco Department of Public Health, where she had worked since 2015. She has extensive experience in community engagement, health education, and management of large health programs, including CDC health disparities grants and the SF Soda tax community grants. She also has an enthusiasm for social justice and health equity work. And last but not least, we have Cristina Mancera. She is also from Community Engagement. She works at Community Engagement Capacity Building Program Manager at the Office of Community Engagement at Stanford Medicine. She leads the professional development programming to build capacity for community academic research partnerships. She joined Stanford Medicine in October 2022 and previously lectured in kinesiology at California State University, Los Angeles, highlighting community engaged research in STEM topics, historical context of distrust, cultural competencies, and the real possibilities of actionable change. Thank you so much for all three of you for being here, and apologies for my typos issues here. So I hand it over to you. Thank you so much.
Thank you so much, Susan, for having us join you in this very well-run science series hosted by the Stanford Center for Clinical Research. Cristina is going to advance our slides for us. So thank you, Cristina. And hello, everyone. Thank you so much for joining us. It's Friday before a long weekend. It's lunchtime, so we really appreciate your time and attention. This is just our title slide. If we can go to the next slide, please. We want to make sure that everyone has a positive experience in today's workshop. It's going to be highly interactive. We're not just going to talk at you for 90 minutes. And we welcome questions, comments, and ideas throughout our presentation today. Feel free to use the chat or raise your hand. Because we're going to have breakout activities, please turn on your camera, mute yourself when you're not speaking, and just participate fully. So, next slide, please. And this is the learning objectives we have for today. We just hope to provide you with an overview of community engaged research and why it's important for biomedical research, the work that we do here at Stanford or any academic medical center. Dongmei will share some important principles of conducting community engaged research. Here we got it shortened to CEnR. And you'll receive practical tips and ideas for working with community partners and principal investigators on community engaged research projects. We see, I think many of you are research managers or project coordinators, and you really are the bridge between community and community partners, community members, your research participants, and your PI. And most importantly, really thinking through learning more about the resources that are available to you at Stanford Medicine for conducting community engaged research, and as well as funding opportunities that will actually support this work, as we know funding is very important. Next slide, please. Just a quick overview of our agenda. We're going to have an introductory activity coming up very soon. We're going to do basics of community engaged research. We're going to walk you through some of the foundational, theoretical, and practical principles. And Dongmei will share examples of that demonstrate the principles of community engagement. And we'll talk a bit about some of the very real yet very solvable challenges that you may encounter in doing this work. And you'll have an opportunity to craft your own plan and share ideas with your colleagues here in the Zoom room. And lastly, we'll share some resources. But before we get started, and especially since we're talking about community engagement, I think it's very important for us to acknowledge the land that we occupy today, where we get to do our amazing work to advance the science of clinical research and science of medicine. We are sitting on the ancestral land of the Muwekma Ohlone tribe. And we want to acknowledge where this land came from and the continued importance of land to the Ohlone people. I want to make sure that we're good stewards of this land and use it that are consistent with the values of community inclusion. And we have responsibility to acknowledge, honor, and make visible the university's relationship to Native peoples. Next slide, please. I won't read this whole labor acknowledgement, but it's equally important for us to acknowledge the history of our country and the fact that so much of our culture, economic activities, and development has been made possible through the violent, corrosive nature of exploitative and forced labor of people from not just the indigenous people, enslaved people, also immigrants, migrants from all over the world. And as we move forward today, as we think about how to engage our community partners, we would love for you to think about how we can really bring in lived experiences and the contributions of all people that have made this country and our work possible. So we will just share this labor acknowledgement here as well. Next slide, please. And really quickly, I just wanted to provide some background information on the offices. I will just introduce the Office of Community Engagement. We were established in 2005, initially as an office that focused on developing offering community-based education opportunities for medical students. And as the scientific field has increasingly recognized the importance of community-engaged research, we have evolved to become an office that really conducts research to advance science. And our mission is to become a national, international leader in developing innovative models of engagement and nurturing community partnerships, and designing and implementing rigorous projects that promote health equity for diverse populations. And in practice, this means that members of our team in the Office of Community Engagement are directly involved in conducting research. So everything we share today, we have tested them out. It's based on our experience of the successes and challenges that we've encountered in conducting and implementing community engaged research, and every administrative challenge that we may describe today based on our experience. So just wanted to share a little bit of that background, and we understand what research coordinators go through when they try to conduct community engaged research. I'll pass this over to Dongmei.
Yeah, thank you, Wei-ting. And yeah, I'm from the Office Community Engaged Research, research at MCHI's Maternal and Child Health Research Institute. Our office was established in 2022. So Dr. Anisha Patel is our office director. So thank you for joining Anisha today. She is here today as well. So if you have any question for our office or like want to learn a little bit more about Dr. Anisha Patel's work, so welcome to reach out to us as well. So our office mission is to promote health equity for maternal and child health population by supporting community engaged research. So and advance strong collaborative partnership between community, academic, and policy entities. So regarding the service we provide as an office, we provide free consultation to the researchers who are willing to use or interested in using community engaged research in maternal and child health research area. And then also we provide like training, like today, the training we provide and toolkits and funding opportunity to the research across campus. So if you are interested in looking for some funding opportunity for your community engaged research, feel free to reach out as well. So I will pass back to Wei-ting. Thank you.
Thank you, Dongmei. And so I think here comes our first interactive activity. Cristina, do you want to take us there? You want to walk us through?
Thank you so much, Wei-ting. So we're going to do a little bit of an icebreaker right now. We'd like to for you all to introduce yourselves to each other and to get an idea of, what your experiences are like right now in your research teams, what your roles are in your research teams, and why you're interested in taking this course. So you're going to be answering this list of questions, and again, just focusing on your research, your projects, your role, and your teams, and what your experience is with community engagement in your personal life. You'll have 5 minutes to meet each other. You'll have about 5 people in each room, and I will be coming around with these questions for you all to answer. I will open these rooms. Thank you very much. Wei-ting and Dongmei, I'll go ahead and put you all in some rooms here.
Thank you.
Thank you.
So I will pause the recording. Is that better, I think?
Sure, yeah, that's great. All right, so hopefully you got a chance to meet some people, perhaps even some people you're working with, and got a chance to talk a little bit about community engagement. So I'm going to hand it back to Wei-ting to start discussing the basics. Thank you.
Great, thank you. So we like to start with the foundations. Next slide, please. Basics of community engaged research. It's always good to start with a definition, especially since we're an academic medical center. This is a commonly applied working definition of community engaged research. It is a collaborative approach. I want to emphasize approach here that equitably involves all partners in the process and recognizes the unique strengths that each partner brings. It begins with a topic of importance to the community with the aim of combining knowledge and action for social change to improve community health and eliminate health disparities. So that is a working definition that we often apply when we're talking about community engaged research. And it's useful to have in the background to really think through what that approach means. We have the reference here for you to look up and also share the resource. I think we have the resource on our website as well. Next slide, please. So now you have the definition. What does that really mean? what does engagement mean? Then I talked about approach and I talked about the process. It is not a one-time thing. Engagement is not a one-time event. It's not just one part of research. It really is the process of working collaboratively with your stakeholders, and it can be anyone whose work or lives or experience may be impacted by the research you aim to conduct. So it's the process starts with that relationship building, understanding each other's priorities and needs, to designing studies and designing data collection instruments, deciding resource sharing, deciding who is going to do the data analysis, and accrediting the authors appropriately for their contribution to the science. So it is a process working collaboratively throughout. And who are we talking about engaging? It can be really broad. And it can be patients and caregivers. A lot of you, I think, work, especially the clinical researchers, you work with physician scientists and their patients. So you're talking about patients and caregivers as potential people you may engage in research. Providers, staff in health centers or hospitals. A lot of you are doing community-based work. And so a lot of times the community-based organizations, I think in my breakout room, I heard East San Jose as an example. Community-based organizations are part of the stakeholders group. Clinics, healthcare systems, not just the people who work there, but the systems, the organizations that you're trying to engage, and policymakers. And if you can think of other stakeholders, I welcome you to use the chat function to provide other ideas of people you may engage in research. Next slide, please. So why is it important to incorporate patient or community engagement in biomedical research? I want to highlight the carrots here. There are lots of reasons to do that. First is by engaging with the people whose lives are impacted by this research, whether through participation or through the end results, we can really understand the motivations for them to participate in research, to think through how to design studies. I think you can advance to all the bullet points, please. And by engaging with them, you're actually improving the acceptability and feasibility of the study design and study logistics. Right? You want to think through if your recruitment strategies really reflect the needs and priorities of your prospective research participants. And then also if it's not a one-time study, it's a long-term study, you want to think through the follow-up activities and how you collect data that way. And this will really improve your participant recruitment and retention efforts. We're doing clinical trials right now, and we understand just how challenging recruitment can be, especially if you are working on studies that involve participants who experience challenges associated with health disparity or struggle with social determinants of health. That is, if they don't have transportation, if they work multiple jobs. It's really important to think through their needs and priorities when you design study activities that way. And you improve the reliability and validity of study measures, right? We all want to, these are really key features of research. You want to make sure that, you're asking questions and the right questions for the population, and asking questions in a way that they actually understand, right? Or make sense to them, not necessarily just linguistic understanding, but that they can understand what you're trying to achieve through their lived experience and living context. You increase cultural and social relevance to the population included in the study, kind of similar to what I just described earlier for the same reason. And by doing all of this, you'll really facilitate the translation of your study findings to the next phase of your scientific discovery or to implementation. We all talk about research to practice, research to policy, but we need a lot of voices to make sure that along the way to make sure that the research findings can be translated to greater audiences, greater segments of the population. Next slide, please. So I want to talk a little bit about the role of the community partner in community engaged research. I'm not a dancer, but I actually think dance is a really good analogy here. And I'll start by the first step. Who's a community partner? I talked about all the different people that can be a community partner, but who's a community partner in research? It can be an individual. Sometimes you are in communities where they have 1 or 2 people who are true community leaders, really want to engage with researchers to advance their local community priority, whether it's health, whether it's policy, whether it's program design, right? Can be an individual. But oftentimes they are part of an organization. You want to include partners from CBOs, community-based organizations, partners from clinics, medical departments. You know, they oftentimes are representatives of an organization that's a community partner. I also mentioned when you apply for grants, oftentimes you do have to have a community partner, like an organization listed of record, to be able to kind of convince the funder that they have the administrative resources and environment to conduct the research that's being proposed. And I mentioned it can be an individual, that sometimes you can include one individual, one entity in your research as a community partner, but sometimes you can find a wide range of stakeholders whose lives or professions will be impacted by the research. So there's no reason to limit your, I mean, depending on your study, depending on your topic, you may find yourself in a situation where your project has just one main community partner who's involved in the design and implementation and interpretation of the research findings, or sometimes you find yourself with a range of stakeholders. You may decide to have a steering committee for your project or a community advisory board. In your project, it varies from case to case. And that is a conversation that I think is very important for the study team and the PI to have with their prospective community partners. Who do we need to have at the table? And, you know, it's the difference between a one-on-one dance, and I already mentioned the dance analogy, and sometimes it looks like a flash mob dance where you have a lot of people working, moving together, in a synchronized fashion, right? And what does the community partner do in research? And the role can be multifaceted. But the bottom line is the partners should be able to make substantive and meaningful contribution to the study. That means in the way the study is designed, it reflects that community partners' real world experience is reflected in the shaping, the development of the research question, in the way the aims are described, in the way the studies are designed, the activities, the data collection, the follow-up, and of course, importantly, dissemination is a very important part of that work as well. And I already said that you may have a single community partner or multiple partners, or you can have this wonderful picture of whole bunch of people dancing together in a part of the performance. So next slide, please. And I think for those of us who, you know, our office sometimes offers a community engaged research grants, and I know the Maternal Child Health Research Institute also offers grants, and we often ask for we actually want to fund community engaged research. And these are some of the features we look for that I think would be very helpful for you to see as well. These are some of the key features for you to kind of bring back to your study team and think through how your current studies or planned studies are the degree to which you're community engaged. So it has a community engagement component. It actually has to be called out in the study description or the narrative. Has a community engagement component that clearly demonstrates community partners' leadership in the design and implementation of the project. We talk about personnel in studies, right? On project proposals, we tend to highlight the scientific PIs expertise, but this is really important to also call out community partners' expertise in this. That's one way to demonstrate community engagement. And in the research activities, we want to see, you want to make sure that it's evident that the community partner, a community leader, and the study PI or key research personnel have equal decision-making authority around the study design, and that they communicate regularly, frequently. It's not just about including the name and expertise of the community partners, but you want to make sure that the study team very intentionally creates communication channels between the community partner or partners and the study team. And very importantly, the study budget actually allocates sufficient resources to enable and accommodate community partners' involvement in the research, including attending meetings, support recruitment, data collection, analysis. It's about demonstrating appreciation for their expertise and time, right? That's part of why I wanted to include that labor acknowledgement, really think through community partners, not just as people who can serve as bridges between the team and the prospective pool of research participants, but really their expertise are valued in the same way your team would bring in outside experts from other institutions. You compensate them for their contribution to the science. We actually there's a patient compensation calculator. I think we're going to include, we can drop that in the chat, but just as a way, we get that question a lot. How much do we compensate our community partners for what they do? So we're going to drop that tool in here as well for you to peruse. You have to create a login. It's not something you can just go to and put in some numbers. You do have to create a login and use the tool. Just wanted to share that with you. Next slide, please. You can advance. I really like this visual from a recent article, fairly recent article on the continuum of community engagement in research. We heard that people have different experiences in community outreach and education efforts, or just community partnership development. And the top part of the top two bars actually reflect community engagement from the community partner's perspective. And the bottom part shows the researcher's perspective and experience in conducting community engaged research. And the spectrum goes from no community involvement at all, to informing the community, to consulting the community, to actual community participation in the research, design, implementation, and then all the way to the right, where we actually see community initiating the research collaboration and community-based participatory research with a strong participation in the research, and then to community-driven and community-led research projects where community partners own the research activities and products, and the scientific partners are really there to support their efforts. And so again, just sharing that with you for you to kind of think through exactly where, just provide an example of where you are on that spectrum of engagement. In our past experience of our pilot grant program, we do see a lot of projects that consider themselves to be doing community engaged research, where really it's research that involves community, informing the community or consulting the community, but it's not actually true engagement in the way we have just described in the from the definition to the implementation. So if we can advance. Yeah, I wanted to highlight this. The red bracket kind of show where we really want to see community engagement, on towards the right-hand side of that's where we see the really meaningful changes and meaningful engagement of community partners taking place in the project. Next slide, please. So before I hand this over to Dongmei, I just want to say, if there's nothing else you take from this portion of the presentation, is that community engaged research is based on relationships and trust. And I also want to highlight that there are lots of tools available for you to develop these relationships and cultivate that trust between. It's not just one way, it's a trust between the community partners and the academic partners. You can find funding to make sure that we value their time, we value their expertise. You can use kind of communication channels to make sure that the relationship is kept alive and well, and the communication, is ongoing, and you have full transparency between the study team, the community partners. We'll just share some examples of that. So if nothing else, relationship and trust, that's really the key from the kind of the foundations of community engagement. I'll stop here and pass over to Dongmei.
Yeah, thank you, Wei-ting, for wrap up your first section with such a strong statement. I really love it. It's like community engaged research. It's a key thing. I would say the core value is regarding the relationship building and the trust. Everything like beside you want to do anything or think about all the strategy, think about like how you can or you need to build up the relationship and trust. Yeah, thank you for that. And then can you help me? Yeah, for Vance next. Thank you. So, and then here is some key principle I would like to share today. So before I got into like the detail of this, I want to say that I don't want to view myself as a trainer here, because I would more like us as a co-learning opportunity for us. So because like here is the key principle we put together, but it doesn't mean like we know everything or like it's everything about this, right? So because I was in the breakout room before, so I already heard a lot of a great example, like how the community engagement they have been doing, like each of you have been doing. So like for me, I just kind of happen to be in this position, kind of share about one of my perspective or experience. But if we have 40 people here, each of you can bring in some examples. So we'll have 40 best practice to share here. So I just want to put it there. So during this section, I would like have you to feel free to unmute yourself to share your experience or question. And then, or if you don't feel comfortable to speak up, so feel free to type out on chat as well. So we would like to have this like more conversational discussion in this section. Thank you. So here's some key principle here from the Follow Your Community Partners lead. Wei-ting has been mentioned a couple of times. That's a key things, like we have to understand what is the community's needs, and then we really follow and listen to them, and all the way to work with the community partners to make sure we have collaborative dissemination, like how we share back the data to the community. Instead, like we take all the data from the community and then we publish the paper and then go, and then the community never hear back from us. They don't know what things going on. That's not our community engaged research purpose, right? So, and then I'm going to talk about like each principle, so we can share a little bit more example for each principle. Thank you. Next slide. All right, so here, before I share my example, I want to hear from you first. So like, how do you engage with community partners to understand or identify community needs and priorities? It could be from your work experience, your project you're working on, or even from your personal life or warranty experience like that. So feel free to put the answer on chat so we can kind of like learn from each other what kind of way, like how you engage with the community partners to identify. I will stop for 1 minute for you to put in the information so we can share back to the big group. Thank you. Great, we got interviews, focus group, and community advisory boards. That's a great strategy we're using. Host meetings, that's good. Great. In community space, right? I love this, is in community space. It's not like you have to come to Stanford for the meetings, right? I'm starting a participant experience surveys for all our studies so we can learn about the participants' needs and be better. Yeah, so it's like more consulting with the community, as Wei-ting mentions. Our work with community partners start through the CEnR DOTA data, and casual conversation, like conversational. That's a good way to engage community as well, and how to get started, the focus group and CAP, and a lot of coffee days with my Wei-ting, I love your coffee days too, right? It doesn't have to be a formal meeting or conversation. Actually, a lot of relationship building is come through this like kind of casual coffee talk, and like a little bit informal, but it's very informational and critical important. And it's important that community leaders, member do not feel the text subject. Yeah, that's true too, right? We don't want them to feel like I'm a study subject for you. I have a lot of problem. You need to fix me, or like we want to view them as they are the expertise for themselves. Like they know the community, they know the essence they have. And then, okay, Michelle also shared we co-creating partnership and agreement. Wow, that's great. That's something you already covered what I'm going to do. So maybe you can be the conversation for that too, like during data collection, listening tour. Yeah, community needs, make sure to see them as people and not as the data points. Yeah, cool. Attendance, participate and contribute to events organized by community partners. Wow, thank you so much for sharing all this amazing information. That's why I love this conversation. Like a lot of things you have been doing, and like the best practice you already have. So this is like the training I would more feel is like the place we all of us can share to each other and learn from each other. Thank you. And then next slide. Oh, another one is the radio participant to outreach to the border generation who is not technical savvy. That's great one too. Thanks. Next. Good. All right, so kind of like wrap back all the information, best practice you share. So just like everything about like follow your community leads, right? It's very important to understand like the research project you are doing is not for public paper or for that. It's more like we want to really the things you are doing is to meet the community needs. So before you do that, you need to listen to the community. So that's one example I want to share is from Dr. Anisha Patel's the projects like during COVID, and then the community partners reach out to her and mentions like because of COVID, and then our kids were hungry, but they couldn't get the food from there because the school is closed, right? So and then the community partners reach out to her and then say, as a researcher, can you help us to assess what the community needs? Like do they only need food, like anything else they need, and what kind of food they need, and what are the best way to deliver this kind of food to the community, to them, so they can really feed the community and address the need. So that they bring in the question, and then Anisha, so basically just like work with the community, listen to them, and then work with them to support the community. So I think that's a great example to like how you follow the community partnersly instead of like you come up the topic by yourself. So basically, so that's one of the key thing I would like to share here. So this like the key thing is like the partners know the real needs because they are part of the community. So they that expertise, they are not only like have a problem. We cannot feel that it's like, oh, we are the professional, we are the professor, we know everything, and then you have problem and come here to help you. I think that is not a good perspective when you come into the community. Yeah. So when the community says it's the right thing to do, you listen and then set the priority, and then that will have an impact. Yeah. Next one. Thank you. Next slide. And then, all right, so the next principle is align expectation. Sorry, another question for you. So what priority might community partners have when you engage in a community academic partnership? So could be a lot of topics, like do you hear from the community what they really need when you are doing this community engagement? Could be food or any other things. I don't want to like put into my perspective first. I want to hear from you based on the service you provide to the community, like any feedback you heard from them. Great. I think Sakura, that is a great point, like how we can save the check. Yeah, we can definitely download the check and then put together this information as a summary and send back to all the attendees. Yeah, thank you. Great. Yeah, that is the priority. It's like study data translate into use for tangible change for the community. Good, Michelle, you already kind of touched on the last key principle, like the data dissemination. Yeah, this now is become a more and more hot topic and critical topic for us to consider as a researcher. Health equity, access to medical care service. Yeah. And probably accommodation, privacy. Yeah, privacy is a good priority for a lot of people to think about, particularly you are working with the patients on their healthcare access like that. With security. Accessible, inclusive language and marketing and study materials. Yeah, actually we got a lot of questions from our research team as well, like what kind of language would be the good language for me to use in my promotion or marketing materials. Like it's not only like translate English into another language, into Chinese, into Spanish. It's like word to word. It's not hard to translate, but how you can make sure the language you use is like the cultural appropriate. The people can really understand what do you mean, and then they don't feel like offense or like they really get your information. That's very important to consider. Sustainability, yes, not just like to grab the data and go, or like just give them a computer and then leave without any other like the follow-up action. They can continue to build up the capacity in the ongoing base, and how we can bridge the academic and community roles into space. That's a good one. Yeah, addressing mistrust. Yeah, that's a good thing as a Stanford, right? So people will ask the Stanford, you are kind of high up there, and then I don't trust you how to use my data, or how you can really, do you really care about our needs like that? So true. Thank you, Wei-ting. Yeah, so it doesn't not the end of the research funding. Thank you. Keep throwing out your information, your best practice in chat. So, and then I will go to the next slide to wrap up a little bit the expectation part. Yeah, that's so true. Why I asked this question, because everybody have their own expectation. So we need to understand that even like my husband, we live in the house every day, but we still the same thing, we still have a different opinion or different expectation. Even you cannot make assumption like, oh, I think my husband loved this for dinner. Actually, maybe they have another experience for today. So they need a burger for today, not Chinese food, right? So that's why it's very important to have an open conversation with your partner as early as you can. Don't make assumption. Don't wait at the last minute. You already kind of like, oh, let's go and to start to launch the project, and then I was like, hey, the compounder come to say, what is our expectation? Do you think we need to help you with recruitment? I didn't know that, right? That would be very bad to rule the trust and relationship you have with your partners if you don't make it very clear on the goals and needs and value and like each partner's responsibility. That's very good. And also like to create a partnership agreement together is very important before you kind of at the beginning of the setting up the project as well. So I know MOU is very tricky things to do at Stanford or in many academic institute. So it's not a favor anymore, out of favor, like based on the community engagement hub meeting I went last week, like people kind of mentioned it's not. So people prefer a simple agreement, but it's very efficiency to address like there's some template here to share like vision, very easy like the philosophy, but it's key things like the purpose of this project, and then like each partner's contribution, and then the responsibility like that. So just like one could be 1 page or 2 page is good enough. Don't make it too complicated for the community partners to read and understand. Otherwise, that you create additional barriers for the partners to work with you. Yeah. So, okay, next. Thank you. Great, thank you, Anisha, sharing our the partnership agreement from the OC Office Community Engagement, like some example. You can take a look. And then the next principle I would like to share is the ensure equitable funding. Wei-ting mentioned it a couple times in her section as well. It's very important to view the community partners as the equal partners. They not only get the leftover from your budgets, like, oh, I will use majority of the budget. So, okay, if I have a 1 penny left or 100 left, maybe I will give it to you. It's not like that way. If you have that concept, the community partner won't feel you respect the work, right? We want to value community partners' contribution, their expertise, the time they put into the project. So discuss the project as early as you can, just like we mentioned the expectation, the same thing, to make sure you understand what the community partners need to work with you. Like, do they need additional staff? Do they need additional funding to buy equipment? Or do they need to hire someone like from the community who speaks Spanish or like speak Chinese or Vietnamese to support the support your project and everything? So, and make sure you budget, put them in the budget. So you can set it as a like subcontractor or like a consultant, depends on the way how you want to set up the agreement with them. And then also make sure you budget the incentive for your participant to pay your community advisory board participants and pay your people who help you who join the focus group or the survey. And then like other budget could be like transportation. Do you want to reimburse them from like travel all the way from East Bay to Stanford healthcare clinics, like that, the parking and space rental? Consider all the things, because we got a lot of question from the researcher when they consulted with us, say, oh, Dongmei, do you think it's okay for us to pay the community partner? I say definitely 100% yes. So, and also you have to do it if you apply for the community engagement grant. Yeah, otherwise, like the reviewer will think, do you really value the community partner as your equitable partner? Thank you. Next. And then here's oh, sorry, can you go back a little bit? I want to mention like the example is Anisha, like definitely her project, she worked with the community partners to, and then actually like not only give the funding to them, like budget for them, and also they work together to apply for new funding opportunity. And then some of the funding, the grant is like led by community partners, like that. They are the principal for the grants. Thank you. Next slide, please. Thank you. And then here is the researchers assist with institutional research process. As each of you working at Stanford, you know, we could have a lot of institutional barriers for us to conduct community engaged research, right? So, and then as a researcher, so how we can support the community partner to adjust this kind of barriers and to advance the process. So the first thing, like if we need to consider to respond this CEnR ID sponsorship, or like to walk through the IRB approval, and then if some of their partners, they need external IRB approval, like are you able, as your team, should be able to work with them to find out the resources and the process to guide them through. Otherwise, that would be very challenging for the community partners to navigate the IRB process on their own. And then vendor consultant or subcontract agreement, as I say, if like the partners or you want to set up the consultant agreement with them, like as a research team, you will be the person work closely with them to put together the agreement, and not like say, hey, you set up all the paperwork and like that. Yeah. And then data user sharing agreement is the key thing to consider as well, to make sure you communicate with the partners, like how to share the data and use the data back to the community. Thank you. Next. And then here is a very good important principle I want to emphasize as well, because this one is not come up once. It's a lot of times to support flexible design and implementation, particularly when you are working with the community partners, you need to be flexible. It's not like, hey, I want to do this. I want to do a focus group with the community, with communities. You set this, design this strategy. It's not say it's a bad strategy, but it might end up like when you walk into the community and talk to them, say, hey, I'm not comfortable to join the focus group for this sensitive topics. I prefer a one-on-one interview or conversation. So as a researcher, when we talk to the community, you need to be flexible. Okay, so that is the voice from the community. Like, are you able to kind of twist or like change your original research plan or strategy, and then try to better support or meet the community's needs? I think that's something you need to always keep in mind, like how flexible you are, how open-minded you are during the design and implementation process. And here I would like to hear from you as well. Like, have you ever run into some situation like you have to change your research study or like the implementation? It doesn't have to be change the topic at all. It could be like such small tools you need to develop, and then you need to tweak and change. Feel free to unmute yourself as well. Yeah. And yeah. And here, like, I would like to share one example is from also the same project led by Anisha about the school meals. Like, she actually ran into the situation, like, during the process, like the school district, and I like went back to her, say, now if the school meal is not the priority for me now for the current, like, such a short period because of the COVID spread. So at the time, like, as a researcher, you want to get your research done for sure, but at the same time, as the community needs is more, the urgent community needs is the most priority for the researcher to consider. So, and then they put their original plan on the way, and then they kind of like, and then as a pediatric, and then she work closely with the school district and community partners to help them to set up the protocol about how to prevent the COVID spreading in school, and then make sure that got addressed, and then like have another conversation with the partners, like, and then continue the research later. So that's kind of like one example, like in the research, during the research, you might run into a lot of change, like the leadership change might be another things you might run to as well. Like the original, that's a leader, they agree to work with you, and then later during the process, the leadership change, another leadership coming, they might not see that as a priority, and then research how you adjust that. Just the priority is another things to consider as well. Just like here's some example to share. Thank you. The next, please. All right, that is the fun thing to discuss. I think people kind of like touch base on the lot of different strategy already. So I would like to hear more from you. Like, what type of dissemination product are most important to community partners based on your experience or like the project you are working on? Do you think they want their publication, the paper, and on that is the community needs, or you think they are looking for other dissemination products? Community events, yeah, that's health education materials based on the research, yeah, and we can share back to the community members. Infographic and videos, yeah, that's very powerful as well. Like, right, the videos very visualized for the people to they can hear, they can see all the image. many of our participants ask for results. Yeah, that's things. At least you need to communicate back the result to the community or your participants. Policy briefs, that's the important one. So like you need to like, after you get all the data, like how are you going to use the data to create a bigger impact, like to influence the system or policy change. So, and then put together, work with community members or partners to put together such a policy brief would be very powerful. And then culturally appropriate materials. Yeah, culturally appropriate is not only English and then like people cannot read, cannot understand. And access to other resources and results. And Maya, you share great toolkits here as well for people. Thank you. Thank you. Great. Thank you. You see, you are the expertise in this area as well. Next one. Next. Thank you. Next slide, Cristina. Thank you. Yeah, here. So I think like you cover all this like important principal product people are looking for, and I agree with each of you. So it's very important. Like we have the mindset. Like after we gather the data, put together the finding, we need. It's not only publication is important. It's not like say you don't need to do it, or is you still need to do that part because for a lot of like academic requirement and anything. But most important from a community engaged research perspective, you have to communicate back your finding to the community, and then the community partners feel like we are the partners. So you are doing something. It's important for our communities. Like the action part is the key things. The data is important, but how are you going to translate the data into an action? Action can including like Wei-ting mentions like the policy brief, and then to advocate for system policy change, like for example, like the school meal, universal school meal, or like the water access at school, and then like other like healthcare system, Medicare to make sure how they can cover for the food security, and all this like policy change have to come from data. And then we need to use this data and to advocate for the change. And then here's some of the product example I share here from Anisha's the project as well, like put together, work with the parent and the school district and then the teacher and community partners, like have a town hall meeting to communicate their finding to the community, and then put together a like a flyer, something like that. And then the parent can present to the local school boards or like other policymaker. They can like take the voice and then to create a policy change. And then also another things is like how during this dissemination process, how you can also support the community partners to build up the capacity. There's another thing to consider as well. Like, for example, here is like to share the grant proposal so community partners can get additional funding. So, and then like they have this like total voice project working together. That's also from the grant Anisha is working on. So this is like some example I share here. So I know I keep talking a lot, and then I saw a lot of amazing information sharing through the chat as well. Like any question you have for me, Wei-ting, Cristina, or even Anisha, who is joining the meeting as well. So we are happy to discuss here.
We do have some Q&A time lined up at the end. So
Yeah.
Should we advance, mindful of time?
Sounds good.
Thank you, Dongmei. These are good examples.
I will pass back to Wei-ting.
Yeah, I will try to, we have another interactive component to this. I'll try to speed up here. So we want to be mindful of potential challenges associated with community engaged research. And I think for us there are many of you who have been doing this work already. So I think it would be a disservice in the community engaged research 101 to not talk about some of the potential challenges. Just so people are aware, there are challenges, as with all things conducting research related, but these are very solvable challenges. So the first one is time. Building strong partnerships and relationships with communities that may not always have had good experience with research institutions is something that takes time, and it takes institutional knowledge, and it takes resources. plan ahead. The research coordinators are great intermediaries between the community and the PIs, but it's really good to make sure that we have on your research team, you have someone who is able to really stay on the team for a long time to develop the partnerships. And if there are going to be transitions, and it happens in the community and in academic on research teams, transitions, personnel changes do happen, but make sure that you're able to retain the relationship between the research team and the community partners. So it's no one owns that relationship. It's really a mutually agreed upon, mutually beneficial relationship, right, between the community partners and the research teams. Priorities may not align. Dongmei already talked about this. So take the time at the beginning, as once you agree, you get to know each other, you agree you want to undertake research activities together, take some time to go over that formal partnership development process to make sure that your expectations and priorities are well aligned. And also highlight where if things do not align, find a way to address conflicts or differences. Community partners have limited capacity, especially the small CBOs, grassroots organizations, or the individual community leaders who engage with researchers. So be mindful of that. Think through, again, in that partnership development process, think through how you need to add the capacity, whether through research funding, adding personnel. There are lots of ways of overcoming that. There are studies where a community based community health center and Stanford actually jointly hired a research coordinator who is sort of the person between these two organizations who can actually recruit participants into clinical trials, right? You don't have to have separate everything. Sometimes it's good to have shared personnel if that's an option. Financing, establishing an equitable budget is a challenge. Really think through what the communities are, partners are contributing to your study, and making sure that in the study design process, allocate the budget accordingly. If you're bringing community partners after the study's design the funding has been issued, we'll talk more about funding opportunities, but find alternative funding opportunities to make sure that the community partners have what they need to do this work. Partnership development is hard. Partnership development is the part before you get research funding. So that's why we're going to share some examples of research, funding opportunities that really support partnership development from both internal to Stanford, as well as large state and national organizations that do that. And there are institutional challenges, and I kind of see them as detours, not kind of dead ends. There are complex administrative processes, there are changes in staffing. Again, I talked about institutional knowledge and the scheduling, timing constraints. It's important to think through people outside of the study team who can help you navigate the institutional barriers. If no one on the team, especially some research teams are pretty small, if you don't have a dedicated project manager, can you talk with your PI's department, finance, or administrative professionals who have experience sponsoring your partners for SUNET IDs, have experience in setting up your partners in our vendor system, so that Stanford can actually pay them, your team can actually pay your partners. Timing, we learned this. I get reminded every other month from my community advisory boards. Please send us your meeting agenda and materials 10 days before the meeting. We don't, because they need time. This is something they do often outside of the day job. They need time to review the information, and they want to be thoughtful in their engagement with the research team. So timing, scheduling constraints are challenging, but the key here is to start planning early. Funding mechanism, or actually national federal funders, the study sections don't always have researchers who are familiar with community engagement, but this is changing. More and more funders are interested in seeing more community leadership or participation in research in a meaningful way. We'll talk more about the resources. Again, these are common challenges, but I can see them as detours to reaching your research goals rather than kind of complete dead end stop signs. Cristina, I'll hand this over to you.
Thank you, Wei-ting. We're gonna switch over now from just talking about it, talking about how applying it. So based on what you all have said in chat, many of you are already kind of on this road experiencing some of this. So I'm going to blow through the next 2 slides because I'd love to get to the discussion for you all to share some of these strategies that you've already discussed. So just again, if you're kind of new to this, I guess it's 101, so this is expected. If you're kind of new to this, we're just going to share some basic best practices on getting started. Defining that community you're interested in working with, really understanding them, getting to know them, like Wei-ting said, spending time there, having coffee with them. If you're already in some level of community, on that continuum of community engaged research, consider where you have some gaps. Our communities are not monolithic. So start to identify what you already know to identify what you don't. But again, if you're getting started, some easy steps here, or rather, they're going to take some time, but start with a referral from an existing partner or people in the community that you already know. This can snowball into establishing a steering committee for your project or an actual community advisory board. And as you start to develop some of these, also do consider that financial aspect. Create these co-learning activities. Some of you mentioned that you're already having community events, hosting meetings in community spaces. So consider implementing some co-learning activities into these spaces that are responsive to community needs. So again, those accessible materials, plain language materials, and then forming these partnerships, and consider bringing in a third party, somebody to broker a partnership agreement. So as Dongmei mentioned, having a partnership agreement there, Dongmei is trained in developing a partnership agreement. So there are some of these resources at Stanford, Dongmei being one of them, but you can always look at that video that Anisha graciously dropped in the chat for developing partnership agreements. And it's best to have a third party involved here to make it most equitable. And all of these to get them into the early stages of these formative qualitative research, especially those of you who have already discussed how.
I think we just lost Cristina. I'm not sure Cristina is there. If you can advance to the next slide.
Sorry for the technical issue. Always have something happen. Yeah. So I think Cristina can maybe join back.
Yeah, I'm going to pull up the slide on my end and continue the deck. Let me see.
I have the slide. Maybe I can do it.
Great, thank you. Yeah. Next thing we start. Yeah. Great, thank you. I think we'll go to the next slide. I think we're going to ask you to break out into small groups again and really think through a menu of possibilities for engagement. You can have different depths of engagement, outreach, consultation, to collaboration, shared leadership, and you can think through different strategies. Some of you already mentioned community advisory boards for your teams. You can think through using casual interviews, one-on-one interviews, or small focus groups in the formative stages of designing the study. Really think through how you want to involve community organizations, individuals in the recruitment and data collection process. We have actually done training, data analysis training with our community partners and really explaining the scientific publication process in one of our long-term partnered projects. So think through that capacity development piece. And then if you work with patients, you know, think about bringing patient advocates into the study, connect them with a PI. What patients may be more willing to share information with research coordinators or medical assistants or nurses, sometimes than with the physicians themselves. So think of the information you're gathering as potential education opportunities for the leaders, the research leaders on your team. And we already talked about the data sharing, and really important to just share their results back with the individual participants themselves. I think people value that. They don't want to just provide data for the sake of science. I think they do that. Yes, they do this altruistically, but I think everybody appreciates knowing more about what they're learning from each individual, right? Next slide, please. It's not advancing. Okay, there you go. So we're going to do small groups, and I see people have had to drop off. It's coming up on time. Just 2 questions. Where would you like to apply some of your engagement principles in your current work? And just also maybe sharing your small group, just the topics or the ideas that have resonated with you. I'm going to open up the breakout room. Oh, the breakout room is already open. I'm just going to open the rooms, and we'll do this in maybe 5 minutes, and then we'll come back. Okay?
I think some of the rooms are not equally distributed. Is that okay?
Yeah, it's okay. It's okay.
To be equally distributed.
And if we can go to the next slide, please.
Yeah. Yeah.
I hope it just everybody got the idea that you don't have to be an expert. You're all doing this work. Everybody is coming at community engaged research in different places and different starting points. You can all do this, and really use every opportunity where you encounter barriers or challenges as a way to educate your colleagues. Bringing your finance managers, bringing administrative professionals to help you problem solve. You don't have to. This is not the responsibility of one PI or one single coordinator. That's kind of the key takeaway for this work. Next slide, please. I think we're coming up on the end. Just some resources real quick. We have the technical assistance portal. We're gonna share the we created a 2-page handout for you on just the resources. You can use the technical assistance portal to submit a request to any of us. There are 5 offices that share this intake portal. We also address and answer questions from community partners. So feel free to use this resource. Next slide, please. And just some funding opportunities. All of the Stanford funding opportunities are internal to Stanford that actually have dedicated funding to support partnership development and community partnered research. And I highlight 3 external funding opportunities. The Patient-Centered Outcomes Research Institute actually has engagement awards specifically to support partnership development between partners who haven't worked together before. And they have funding for large organizations and small engagement funding opportunities with smaller CBL. So it's really exciting to see that. Compass is a new NIH initiative out of the NIH Common Fund that funds partnered research to advance science. And the community actually has to be the PI submitting these funding proposals, but they have to partner with researchers. So that's another exciting external opportunity. And the California Breast Cancer Research Program, I highlight that because that's the one program I have had experience with that really thoughtful about allocating resources to community and academic partners. But the University of California Office of the President actually administers several community partnered funding programs on tobacco control and climate change, in addition to breast cancer related research topics. Just wanted to highlight these opportunities, resources for you. I think the final slide is just the handout that we're going to drop in. In fact, I think I have the link right here. Let me see. And you will be able to walk away with some resources that you can consult. All the links are, all the resources are hyperlinked. And you can go to the source material or feel free to send us a question. So we are a little bit over. Sorry about the technical difficulties, but I'm happy. Maybe you can put our contact information slide up. Can email us directly, or I'm happy to stay on for a few minutes to answer questions here. But yeah, thank you.
Thank you so much. Thank you so
much.
much. All three of you. I know Cristina cannot be here, but thank you so much for this very informative presentation. I really appreciate it. And I don't see any questions left in the chat. So please feel free to unmute yourself. As I mentioned, I will send out the slides and the recording will be available on our website as well. And I will send out the evaluation. Please provide your feedback. And please, as I mentioned, please enroll in our part 2 that is coming up for March 8th. And you have option to either join via Zoom or preferably, hopefully we'll see you in person at Li Kai-shing room 102. And thank you so much again for your time and expertise in presenting this topic. And please feel free to email the presenters or myself, and I will forward your questions to the presenters. And or if you can stay a couple of more minutes, by all means, unmute yourself and ask your questions. I will start the recording here. I will stop the recording here. Right.
Thank you, Susan.
Thank you. Thank you so much.
I will stop share.